In this video tutorial, we will talk about how to exactly wear these type of masks. We'll talk about the N95 mask and we'll talk about the classical 3-layer surgical mask. So before we dive into the actual topic, we need to understand 2 points, then we'll come to the main topic. One is how exactly and what exactly we want to prevent from. There are 3 sources of infection: direct contact, the other 2 are droplets, which are more than 5 micron in size and it dropped in a nearby vicinity. And the third and the most important consideration is aerosols, which are smaller than 5 micron in size, and the viruses can remain suspended in the aerosols in the air. So the basic purpose of these type of masks, whether it's N95 or 3-layered mask, is focused on the aerosols. And if you're doing a aerosol generating procedures like scaling or using handpiece, then the importance of these masks greatly increased. So one thing. Second, we need to understand that how does it filter. In the N95, many of the N95, you can see the valve. So all the air must pass through these valve whenever you inhale and whenever you exhale. So there's a tight seal around the mask from where the air should not be leaked or sealed. So all the air should be passing through the valve of the mask. So now come to the point, how you need to wear it. 3 things you need to consider. One is a steel strap around the nose. These steel strap must be tightly and nicely fitted around the nose. If you are purchasing a kind of a N95 mask or 3-layer mask which is not having a good metal strap around the nose, it will not be able to nicely control the leakage of air around the nose. Second is the ear loop. If you are using a kind of mask which is very loose, then you will never be able to achieve a good seal around the mask. Third is the tightness and contour of the mask with reference to your face. How to wear it? You will wear it something like this, and then you will pass it on the air. Then with the both hands, not with one hand. If you're using with the one hand, there's a possibility that you could have air leakage from this area. So you will use the both hands to contour the mask around the face, and then you check the seal of the air. And how would you check the seal of the air? By having both hands around the mask, and then you inhale and exhale. Whenever you inhale, there should be a sucking effect or inward movement of the mask when you inhale, something like this. If I am having a tight seal, something like this, then on inhalation it must be moving inward. And on the same time, you can check the exhale test, and you can check the air leakage having by placing your both hands around the mask like this. Now I can see the air is passing through this. This is a tip. How the N95 is better than KN95. KN95 has an ear loop, and the ear loop is relatively less efficient as compared to the head strap, which go around the head in tightly sealing the margins of the mask around the face. The clinical superiority of these type of N95 mask versus the 3-layered classical mask is because of its seal. The 3-layer masks are not so efficient in controlling the air leakage around the mask. You would have a leakage of mask somewhere around there. These masks are good if you are doing a kind of a procedure where you want to prevent the wearer breathe, and it's very challenging to get the air seal around the 3-layer mask. In the 3-layer mask, you have hydrophobic layer on the outer surface. This hydrophobic layer is, if you put some droplets in, it is not get absorbed inside the mask. So that in the 3 layers, the most outermost layer which is facing the environment is hydrophobic, and the inner layer is hydrophilic and moisture absorbent. So